Hi, my name's Lisa. I'm a nurse from the University of Utah Health Burn Center, and I'm going to demonstrate a Silvadene or Thermazene dressing change for you. This dressing can be changed once or twice a day depending on what instructions your provider has given you. The first thing I like to suggest is getting out all of your supplies so you're ready once you've washed the burn injury, you're ready to put the dressing back on. So the first thing to do is wash your hands, remove the old dressing, and then wash the wound with a non-perfumed soap and water in a circular motion to remove all the ointment and any loose skin. And you may go through several washcloths to get this all cleaned off. And if there's bleeding around the edges, that is normal. And sometimes these wounds can be painful. Once you've rinsed off the soapy water, then you can pat the area dry. Then go ahead and wash your hands again so they're nice and clean. I like to suggest using gloves for Silvadene dressing changes because the ointment can get under your fingernails and it's messy. So put down a towel because some of the ointment might fall off. Then the hand that you're going to go into the jar with is not the hand that you want to touch the patient with. And then you want to put this ointment on thick, covering all of the burn so that you can't see through it. So like I said, it's kind of messy, but you want to put it all on everything. And so then if you need some more ointment, you can get some more, wrap it, apply it all over the area. And then on the fingers, what I like to do is take some 4x4 gauze, open it up, and then individually wrap each finger and crisscross it over the back of the hand. And if it wipes off some ointment, that's okay, you can touch it up. So each finger, it's nice to kind of have these fingers in a little bit of extension. And then touch up the area that you might have wiped off the ointment. We're almost there. And the last one. If the palm is burned, you can take a few of these 4x4s, maybe 2 or 3 of them, and put that in the palm. And then we're going to take gauze, poke a little hole in it for the thumb. That provides an anchor. And then you can wrap this around. And sometimes you need to do another anchor to secure it. And then go ahead and go up a little bit higher than the burn extends, because the dressing sometimes can have a tendency to slip down. So if you go a little bit higher, that's good. If you have extra supplies, you can keep them clean and use them for the next dressing. This is finger netting. Go ahead and cut a piece off. I've pre-cut some, but I wanted to show you how to cut them. And then you can slide this over each finger. And if you pulled on the dressing and it came down, that's okay. Just readjust it a little bit. And you don't necessarily have to, these can stay a little closed at the tips too, if that's something that is bothering you. One more. And then I'm going to show you the netting for the hand. So, and you can take off your gloves at this point if you like, it's really your preference. Come down several inches and then just put a little hole in there because that becomes the thumb. If you put it too far, then it's kind of annoying. You can always cut some more, but Then this is gonna slide over those fingers, and then you've got that hole for the thumb. And then go ahead and slide it up the entire arm. And then something else that people like to do is maybe take some yarn and tie the finger netting to the hand netting. I didn't get some of that to demonstrate for you, but you can use yarn or something else that's clean, and then you can secure those together, and then that will hold your dressing on. These wounds sometimes drain a little bit, so sometimes you have to touch them up throughout the course of the day. Keep this dressing clean, dry, and intact. If it gets wet, you'll need to change it. And if you have any questions, you can call our Burnout Patient Clinic at 801-581-3050. Thank you so much.